This information video has been produced with the collaboration of your veterinarian. Resistant bacteria are threatening modern medicine. Physicians, veterinarians, and their respective patients or caregivers have an important role to play in slowing the progress of this healthcare crisis. Human health, animal health, and environmental health are all being impacted by bacteria mutating to become resistant to antibiotics and disinfectants. Bacteria are an incredible life form with a reproductive lifespan measured in hours. The result is organisms capable of rapidly mutating to become drug-resistant superbugs. The use of antibiotics in human or veterinary medicine is a relatively recent phenomenon. The first antibiotic, penicillin, was discovered by Alexander Fleming in 1928. Over the decades, several other antibiotics were developed. At the same time, bacteria have been mutating to become drug-resistant. It's been a race pitting human ingenuity with one of the oldest, simplest, and most adaptive forms of life. Unfortunate to human, animal, and the environmental health, bacteria are winning. The emergence of highly resistant superbugs is a worldwide phenomenon that literally threatens modern medicine. The viability of modern procedures like joint replacements or organ transplants are threatened by the risk of developing untreatable and fatal post-operative bacterial infections. To understand antimicrobial resistance, it is important to appreciate that whenever an antibiotic is taken, the patient's entire bacterial biome is exposed to the drug. You may be prescribed an antibiotic for a treatment of a wound infection, but all of the body's bacteria are also exposed to the drug. Harmless and often beneficial bacteria that live on the skin, gut, respiratory tract, and other areas are being impacted. On a microscopic level, bacteria susceptible to the drug are killed or fail to reproduce. However, those that have mutated to a resistant form continue multiplying. Physicians, veterinarians, and their respective patients can slow the emergence of resistant bacteria. Veterinarians, like physicians, are legally and ethically obligated to prescribe antibiotics only when indicated. This requires the patient to be examined with enough diagnostic testing to establish a preliminary diagnosis, ensuring that an antibiotic is indicated. Patients or their respective caregiver have an equally important role. Prescribed antibiotics need to be taken as directed. Missing a dose or failing to take the entire prescription creates a situation in which bacteria are exposed to the drug below therapeutic levels, creating an environment that encourages the resistant strains to thrive. Antimicrobial resistance is a real threat to human and animal health. Failure to act is not an option.